There's a hidden truth most seniors never hear from their doctors. Every year, millions of older adults line up for routine health checkups, believing they're staying safe. But what if some of these tests actually increase your risk of surgery, stroke, or even cancer? Research shows up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And 99% of people over 70 have no idea they're being overtested. One checkup on this list is linked to 5% of all cancer cases in the US, the same as daily alcohol consumption. Let's uncover the 5 most overused checkups after 70, what the science says, and safer alternatives you can choose instead. First up, annual full-body CT scans. Marketed as preventive packages, these scans expose you to massive radiation, up to 500 chest X-rays worth in one sitting. There's no evidence they save lives, but strong evidence they can cause harm. Studies suggest up to 5% of all U.S. cancers may now be linked to medical radiation from CT scans. These scans often detect harmless spots or nodules, setting off a chain of follow-up scans, biopsies, and surgeries that can cause lasting damage. Unless you have specific symptoms, like unexplained weight loss or coughing up blood, avoid full-body CT scans and opt for targeted imaging only when needed. Next on our list is the colonoscopy. While life-saving for some, colonoscopy, after 70 especially past 75, carries higher risks than benefits. The prep can cause dehydration, sedation may harm brain function, and the procedure itself can cause bleeding or perforation. A study of 1.3 million patients found that for every life saved, 10 people suffered serious complications. If you're healthy and symptom-free, a non-invasive stool test like FIT is far safer and still detects most serious cases. Third, we have the cardiac stress test. Often given for mild fatigue or vague chest tightness, stress tests in people over 70 can have false positive rates up to 40%. This can lead to unnecessary angiograms, stents, or bypass surgery, none of which improve survival or quality of life in those without symptoms, but do increase the risk of bleeding, kidney damage, and long recovery times. If you're not experiencing classic heart symptoms like exertional chest pain or shortness of breath, safer alternatives include a resting EKG or a coronary calcium scan. Fourth on our list is the brain MRI for mild memory loss. Mild forgetfulness often leads to MRIs, but in older adults, they usually show harmless age-related changes. Unfortunately, these findings can cause fear and trigger unnecessary and risky procedures. A 2021 study found 97% of MRI abnormalities in seniors had nothing to do with treatable conditions. For mild memory concerns, start with a cognitive screening test instead. And reserve MR is for serious sudden neurological symptoms. Last but not least, we have the bone density scan, also known as a DEXA scan. Quick and painless, this scan measures bone strength and is often used to diagnose osteoporosis. But after 70, mild bone loss is normal and doesn't always need treatment. Too often, these results lead to prescriptions for drugs like bisphosphonates, which can cause serious side effects with minimal benefit. If you've never had a fracture, focus on proven lifestyle steps, weight-bearing exercise, balance training, vitamin D, and calcium-rich foods shown to cut fracture risk by over 20%. Bottom line, medicine can save lives, but more testing isn't always better. Before agreeing to a checkup, ask, if this test finds something, what happens next? If the benefits aren't clear, or the risks are higher than the rewards, you might be better off skipping it. Prevention starts with how you live, stay active, eat well, sleep deeply, and choose your checkups wisely. Have you or someone you know faced complications from an unnecessary test? Share your story in the comments. We'd love to hear it.